The voice is known to be just as important as your looks in determining people's first impressions. As more people recognize the importance of this, they are showing greater interest in maintaining good vocal health. There are many reasons why the voice changes. In cold weather, the frigid and dry air constricts muscles, causing damage to the vocal cords and the voice. Also, for those who have a groove or infolding of the mucosa along the surface of the vocal cord, a condition known as sulcus vocalis, or if they have developmental disorders, it can also cause rough and hoarse voices. Shouting or hitting notes that are too high for the average range can make the vocal cords tired and susceptible to damage, even from small stimuli. In the case of a cold or other minor conditions, such as laryngitis, simple treatment can be used, but vocal cord malformation or nodules require greater care and special treatment. Everyone prefers to have a nice voice, but some face greater challenges in maintaining a healthy one. For those with problems, there are various treatment options, including voice rehabilitation, Korean medicine treatment, and voice training. We'll get a closer look at these methods today and examine how you can keep your voice in good shape.
So the method to having a good voice and keeping that good voice in good shape. Joining us is Dr. Kim Hyung-tae from the Yesong Voice Center. Good morning, doctor.
Good morning.
Sounds like you're bragging a little bit with your voice.
I'm just trying to sound good. Impress the doctor.
Good morning to you.
Good morning.
So,
Good morning.
because of our job, we three use our voices a
Yes.
lot, and we try really hard to keep it in good shape. So, what are some of the small habits that can be bad for our voice or vocal cords?
Generally, voice problems arise from a variety of sources, including abuse and misuse and cancer, infection, or any kind of trauma. So the most common of three bad habit is abuse, misuse, maluse. So in case if someone has a heavy cold and had tiredness, if they try to make a long-term talking, yelling and screaming and smoking and drinking, that induces a voice problem and injury of vocal fold.
And I get told a lot that I have a unique voice, I suppose, a bit nasal. I think it's because I have a chronic rhinitis problem. So how does these illnesses in other parts of the body affect your voice?
Yes, of course, those that are vocal fold disease and laryngopharyngeal reflux and allergy and thyroid disease and neurological disease and cancer can induce a voice problem. So voice habit change over 2 weeks without any specific reason. I think they might be better to check up the larynx by ENT doctor.
Well, aside from some of the factors that you mentioned, doctor, there are other factors that can actually lead to a bad voice or vocal problems. So we'll get a look at some of those.
Each Saturday, people get together here in hopes of transforming their voices. A 1-month course is offered here to help people train their voices, and it's popular for its intensive training.
I wanted to leave a good impression with my voice during job interviews.
I came because my voice is usually quite weak and I have vocal tremors.
I thought that having a good voice and pronunciation would be important when having conversations with other people.
The class is carried out in a group, and it focuses on pronunciation, vocalization, and breathing drills while participants read sentences. It corrects the voice through continual training with intonation and rhythmic repetition so that participants can have more accurate pronunciation with stronger delivery.
바닷가에 나가 조개를 주우며 마치 쭉쭉 뻗어 있는 나무들처럼
고전길을 따라 걸어가면서
소리를 지르면 가슴이 활짝 열리는 듯하다.
A lot of people believe that you're born with the voice you have, but you can change it by making the right efforts. That's why a lot of people come here to alter and improve their voices.
There are methods in Korean medicine that can help improve the voice as well. Pressure points around the neck, such as 인영혈 and 천돌혈, are stimulated in order to release energy gathered in one spot. This makes breathing easier so that the voice is more relaxed. Patients are also given mouthwash made with Korean herbal ingredients such as hagocho and toboknyeong, to help produce a healthier voice. Moxibustion is applied to the pressure point, 어제혈, which provides warmth to the lungs that can lead to greater flexibility and hydration of the vocal cords. It also stimulates warmth in the face and draws out substances in the nose to create a clearer voice.
If you have a bad digestive system and experience esophageal reflux, or if your voice is easily irritated and you get phlegm, you need to consume foods and drinks like ginger tea that are good for your digestive system. On the other hand, if you have postnasal drip or a bad throat, you need to consume bellflower roots or ginkgo that can help reduce phlegm and clear your voice.
This is the first comprehensive voice examination center to be established in the country. Here they use a multi-channel photokinetic evaluation device, the first in the world, that analyzes disorders in the voice by examining the patterns and characteristics of breathing and the vocal folds.
In general, we can check incorrect vocalization of sounds that people currently have, their pitch, strength, vibration, and continuity in sounds, as well as breathing patterns.
As this technology gains recognition around the world, patients from some 40 countries have visited the clinic as of last year. Simona Mayer, who is from Germany, also visited the center in hopes of changing her voice that she feels is in too low of a vocal range.
First of all the positive results that I found on the internet of patients that have come here, and also the very negative results that I've heard of others. So that's why Jason was the #1 choice for me.
If the movement and vibration in the vocal cords is irregular, creating continual tremors, Botox is injected to regain tension and volume in the folds to reduce the symptoms. When the patient has vocal nodules or polyps, microlaryngeal surgery is first carried out, followed by PDL laryngeal surgery that removes abnormal tissue with a pulsed dye laser while preserving the healthy tissue. No damage is done to the laryngeal tissue, and it has excellent control over bleeding. After surgery, a speech therapist helps you improve pronunciation and manage your voice so that it can regain clarity.
It's different for each patient, but usually over 1 or 2 months, within 5 to 8 sessions, we run programs on breathing, vocalization, resonance, and articulation.
The voice is one of the most important tools when it comes to expressing yourself and affecting people's first impressions about you. Through regular care, make sure you maintain a healthy and confident voice.
How you can use Botox or fillers to solve that problem on your vocal cords. You usually think about aesthetic purposes when you think about Botox and fillers, but these problems can't be solved by one-time injection, right?
No, it says Botox is just a temporary effect. So Botox and filler in biocompatible material is just we thought to be just a treatment tool. So in Botox is need to control the vocal cord tremor in some case have spasmodic dysphonia. Spasmodic dysphonia has vocal cord tremor, so then make a breaking and tremor and sometimes cracking sound. So in that case, we inject Botox to control vocal cord tremor that improve voice quality. And if someone has vocal cord paralysis, that makes some weakness of the vocal cord. So in that case, we inject biocompatible material in vocal cord to augment vocal cord volume and tension, so that improve good voice quality. So, but Botox, it'll take just 1 minute and short time, but this treatment need not just one shot, but continuous long-term treatment to control and normalize and voice problem. And so every month, Botox injection for 6 months or 1 year, it will be helpful to normalize and vocal cord problem.
Okay, so you can actually treat this on a permanent basis with Botox if it's treated for over a year.
Yes, right.
Okay, but what if your condition is a bit more severe? What if this is something that just can't be fixed with Botox or fillers? How severe does the condition have to be to require surgery?
In require surgery, it's a voice disease. It's a permanent disease. In that case, we need some permanent surgery. So such as vocal nodule and polyp and cysts, and some cases mass that develops in vocal cord mucosa could be considered to treat by microlaryngeal surgery. So this kind of mass and permanent disease, and so we have to perform the surgery. So, but in some case, if those who have male voice, even they are genetically female due to an hormonal problem and genetical problem and ovarian cancer that induces male voice, even they are female. So in that case, we consider to perform the surgery, voice feminization surgery, to change their vocal fold shape to female shape, so to improve the voice quality.
So many different ways in doing that. Now, I'm so jealous of Young. He has a great voice.
You want to sound like me?
Yeah, for sure.
You're going to have to go to him.
Yeah, I agree
No,
with
but so
that.
how do you keep your voice in good shape? And I know how you could speak from the bottom of your stomach and not from your throat, which I do. Just give us some tips and pointers.
I think that first is most important thing is previously I mentioned that to avoid a bad habit. That is abuse and misuse and maluse. And the second thing is drink a lot of water. So that lubricates your high-speed movement vocal fold. And third thing is good posture and perform the frequent laryngeal massage to relax your laryngeal muscle. So let me explain that. Just to use the two finger, index and thumb, and locate it in third cartilage in Adam's apple in here, and go back to side and just feel an upper high bony structure and low bony structure.
Oh, yeah,
that you feel that the space in between two bony structure and gently compress and widen this space. It's like this.
Okay.
And massage in here.
Wow.
So that relax your contracted straining your laryngeal muscle that prevent any further laryngeal disease.
Let me hear your voice,
That make a good voice quality. But frequently you have to do. If your voice is hoarse and if you feel any pain on your neck, frequently
A couple
do
of
this.
times a day, maybe?
Yeah, every day.
Every day. All right.
All right,
Thank
well,
you so
sounds
much,
good.
doctor.
Yeah, we got to do that.
One day I'll sound like Young, hopefully.
No, you don't want to do that.
have to undergo
And I guess we all have to
surgery
kind of refrain from those drunken nights at Norebang to keep your voice well. Dr. Kim, thank you so much for joining us.
Thank you. Thank you for your invitation. It's my pleasure. Thank you.